In the realm of viral infections, particularly dengue fever, the diagnosis involves a keen understanding of specific markers such as NS1, IgM, and IgG. These markers play pivotal roles in identifying the stage and nature of the infection in a patient. NS1, or the non-structural protein 1, is a protein secreted by the dengue virus. It becomes detectable during the acute phase of the illness from days 1 to 7. This antigen is crucial for early detection, as its presence indicates active viral replication often before the immune system mounts a response. IgM antibodies are the body's initial defense response against the virus. They usually become detectable from days 4 to 5, reach their peak around 2 weeks, and then gradually decline over the next 2 to 3 months. A positive IgM suggests a recent infection. When IgM is positive, but IgG is negative, it typically indicates a primary, first-time infection in its early immune response stage. IgG antibodies are produced later in the course of the infection and can persist for years, sometimes lifelong. IgG antibodies usually become detectable after day 7. The presence of IgG indicates past exposure or a later stage of the current infection. When IgG is positive with IgM negative, it points to a past infection or immunity. When both IgG and IgM are positive, this could mean a secondary infection or a later stage of a primary infection. Together, these markers create a timeline for the progression of dengue. Days 1 to 4, NS1 positive, IgM and IgG negative, indicating an early infection with high viral levels. Days 4 to 7, NS1 may still be positive or negative, IgM becomes positive, and IgG may remain low or negative, suggesting the primary immune response is starting. Week 2 onward, NS1 negative, both IgM and IgG positive, marking the later stage of the infection. Past infection, NS1 and IgM negative, IgG positive, indicating immunity from a prior infection. In short, if NS1 is positive, it points to an early infection. A positive IgM indicates a recent infection, while a positive IgG suggests past exposure or a later stage infection. When both IgM and IgG are positive, it suggests a later phase or secondary infection.